Hello, this is Andrew Kohlmeyer at Andrew Kohlmeyer Medical Massage, and today I would like to talk about sciatica. So sciatica is basically you have soft tissue mineralization over the nerve that irritates the tissue around it. So basically what you have to do is you have to break that soft tissue mineralization up off of the tissue. So here is your sciatic nerve, and you would find mineralization sort of through this nerve, all around the nerve. So you'd have to clean that up. And how are you going to do that is deep friction. So you're going to use deep friction with no real glide on the skin surface. Maybe just a little bit of glide. But you're working deep into the tissue. So you're just going to try to break that stuff off of the nerve. There's a nerve back. So basically, how that kind of happens and why that really comes on is you have repeated cycles of inflammation that leave that material. So what happens most often is you have a backup or a sluggishness of getting your lymphatic products back to your heart. So that efficiency fails and you get inflammation in the leg compartments because you have less space. It's a lot tighter there, so things have to work a lot harder. Some things that complicate it are also the piriformis can get tight. Again, it's usually because of that pressure buildup makes this piriformis work harder, and you get compression of the nerve. Most of the nerve pathways for around this piriformis are under that muscle. Sometimes it's through the muscle, which is obviously, that's going to make you more susceptible to sciatica. So, things you need to do is, like I said, you need to get the lymph down. You can look up, I have a lymphatic drainage video. You can do that, but I'll run it basically over that. Is your legs drain into L2, which is your cisterna chyli. Everything's got to drain to right there. So things that can get in the way of that are you can have mineralization at the border of your sacrum. And again, you just would go in there and clean that up. You'd want to get, this is your garment line. So everybody wears clothes and you wear basically a big rubber band around your waist, and your body fights off everything that contacts the body. So it's going to fight that off, and you're going to get the same thing. You're going to just basically kind of cut in half almost. So like I mentioned, everything in the legs has to drain to L2 and hit that cisterna chyli. So you have to enable that flow to happen. It's like a river inside of you. You got to get everything up. So right there at that L2. So you have to clean up the garment line stuff, that rubber band from clothing. You have to clean up the border of the sacrum, clean up the piriformis. You need to get this piriformis to relax. And that'll happen when you take the inflammation away from it, because it's going to drop the action potential, electrical value of these muscles down, so it won't be so energized. That muscle tension will be reduced, and it won't be so tight and clenching on that. And that happens from removing that pressure. I use, it's basically a potato masher, so I clean it up, then I'm going to sweep that pressure out through, just like that. I'm going to clean that up. I'm going to work on the outside of the leg first, really into that garment line. Sometimes I work on people fully clothed, so sometimes they have clothing that it makes it kind of difficult, and this just goes right through that, like it doesn't even exist, which is really nice. Then I'll go on the medial side of it and do the same thing. So we're in there. It's important to get the pelvic floor. So you're going to get in there with that. It's a great tool for that. You're going to get in there, and it's going to reduce that compartment pressure on this piriformis. So if they're really sensitive, then you with that pressure down, you can go in there and clean up that nerve. You can get that mineralization off that nerve and at the sacral border and the garment line. So it's not that complicated, but it's just, I don't know, it's tough to get otherwise. That's why this can be persistent. So that's the method to really get control over sciatica. So I hope this helps someone out. All right, take care. Bye.